Welcome to Age Friendly Cleveland. My name is Mary McNamara, and I'm the Director of Aging for the City of Cleveland. Across our country, we have what we call an aging network of services because no one division of government, hospital system, agency, or faith-based organization provides all of the services an older adult might want or need to age successfully. As examples, some older adults may need transportation or modifications to their home or home health care or resources to stay engaged after retirement. It is our hope with this Age Friendly Cleveland series that you might learn more about the resources right here in Cleveland. This next segment is about one of our trusted agencies or departments we work closely with every day to make Cleveland an age-friendly city. Welcome to Age Friendly Cleveland. My name is Mary McNamara, and I'm the Director of the Cleveland Department of Aging, and today the guest host of our Age Friendly Cleveland segment. My guest today is Sarah Florimonti from the Ohio Senior Health Insurance Information Program. First, welcome, Sarah. Really glad you came up from Columbus.
Thank you for having me.
Sarah, first, tell us a little bit more about you and how long you've worked for the Ohio Senior Health Insurance Information Program.
Absolutely. So my name is Sarah Florimonti. I'm actually from the Cleveland area, so I'm really happy to be back with you guys. And I've worked for OSHIP for almost 5 years.
And your role there?
I am a community liaison, which means I come out into the community, go to libraries, senior centers, anyone that will have me to talk about OSHIP and Medicare. And I also liaison for a whole host of volunteers around the community. So my job's kind of double-faceted.
So many viewers out there you might look familiar to them.
Absolutely. I think one of your staff members actually recognized me earlier today from seeing a presentation at the Rocky River Library. So like I said, I'm all over Cleveland and the Cleveland area.
Great. Well, so before we get into more about your role and information you can share, I want to tell viewers more about OSHIP, which is a funny name. I've said it a couple times, it's a longer name. So tell us, what is OSHIP?
Absolutely. So OSHIP stands for the Ohio Senior Health Insurance Information Program. So our job is to provide objective, unbiased information when it comes to Medicare. So we're actually funded through a federal grant, so we're federally funded. And like I said, our only objective is to provide unbiased information when it comes to Medicare. OSHIP is housed inside the Ohio Department of Insurance, so you can find all of our information at the Ohio Department of Insurance website, but we are a program that is inside of the Ohio Department of Insurance.
And Sarah, I've read that every state has what's called a SHIP. So tell us about that network.
Absolutely. So every state, like you said, has a SHIP program. So if you have a relative that lives in a different state, or if you're moving to a different state, it's really important to know that this federally funded program is available in every single state. So it's as easy as a Google search, putting in Pennsylvania Senior Health Insurance Program, and you can get that unbiased, objective information that's state specific.
So our state's name, OSHIP, the O stands for Ohio.
Exactly.
And then the SHIPs in other states would have different acronyms to start with.
Absolutely. So we had to fight Oregon and the other O states for OSHIP, but we got it.
Great. So Sarah, you told us a little bit about your role, community liaison. You're out in the community educating individuals, but OSHIP where is the office located?
Yeah, so the office is located in downtown Columbus. So some of our older viewers might be familiar with the old Lazarus Department building. It's a historical building in downtown Columbus, and that's actually where OSHIP is located. So when you call OSHIP, you actually are talking to someone right here in Ohio, and we're happy to be down there.
Okay. I know you've shared so much about OSHIP is related to Medicare, and so I want to make sure viewers know more about Medicare, what it is, who's eligible. I think lots of us think about Medicare as that red, white, and blue card, but I think lots of us also can get confused with Medicaid. So let's start with, what is Medicare?
So Medicare is a federally funded insurance program. So Medicare, you can qualify for it when you turn 65. So most people age into Medicare is what we say. So again, when you turn 65, you're eligible for Medicare. It's also really important to know that people under 65 can be on Medicare as well. So if you are on federal disability receiving a disability benefit, you may be on Medicare, or if you're diagnosed with certain disease stage, the most common one being end-stage renal disease. So most people are 65 to qualify, but there are people under 65. And it's really important to, like you said, the difference between Medicare and Medicaid. Medicaid is income and resource based. So if you have someone who's low income with low resources, they may qualify for Medicaid, but everybody at 65 is going to qualify for Medicare. So that's the differences. Those two programs do work together though, however, so if you are on Medicaid, you can also be on Medicare. So they do work together in certain ways, but like you said, it's important to know the differences. It's important to know that when you turn 65 here in the US, you're going to qualify for Medicare.
So let's go a little bit further with that and talk about, so when someone becomes eligible for Medicare, I know they have some choices to make. And what are those choices? And what should they know when they are trying to make those decisions?
Absolutely. So when you're on Medicare, you have two options to choose from. You can be on what we call original Medicare, and usually with original Medicare, you're also going to have a supplement and a Part D plan. So you're going to have kind of three separate things that work together. Or you can be on something called a Medicare Advantage plan. A Medicare Advantage plan is a managed care plan that's offered by a private insurance company. So it kind of replaces original Medicare. So you have those two options. A couple things that are important to know is when you're starting Medicare, so when you age on to Medicare at 65 or whenever you're starting, the decision you make then can influence the options you have later on in life. So if you're not yet on Medicare, it's really important to understand those decisions and how the decision you make now can affect later on. If you're already on Medicare, it's equally as important to know which option you have so you fully understand your benefits and making sure that you're taking advantage of everything offered to you regardless of which option you have. So it's important to, of course, understand your insurance and what you have and how Medicare works depending on what option you're on and the changes that you could possibly make.
Okay. So how does that choice then affect the cost?
Great question. So like I said, there's two different options. There's option original Medicare with a supplement, and then there's a Medicare Advantage plan. One of the big differences between those two plans is the premium. So with a supplement, you're going to be paying more every month, but then when you use your insurance, you're not going to have as many out-of-pocket costs. With a Medicare Advantage plan, your premium is probably going to be much lower, but you're going to pay as you go. So you're going to pay copays and out-of-pocket costs as you go. This is all really complicated, and that's why OSHIP is there, to really dig in deep. We're just scratching the surface here, to really dig in deep and talk about those different options and how your insurance works.
I'm so glad you said that because it's overwhelming.
Yeah, absolutely.
And there's a lot of choices out there, and that's really why we wanted to bring you on this segment today to remind viewers that you're unbiased. The organization you work for doesn't care what plan you choose. They just want to help you find the right plan.
Absolutely. So we can walk people through, what the different options are, and then inside of those options, what your options are as far as your insurance company goes. So we can go over all of the different options for Medicare Advantage plans, what those copays look like, what those networks look like. And the same thing with the Medicare supplement, your Part D plan, what those different options are. And like you said, we're objective, we're unbiased, we have no skin in the game, so we can really help you make those decisions in an objective fashion.
It's a great resource.
Yeah,
it's really a great resource. So I know some of the costs might be too much for some people to afford. So there are some federal programs to help people reduce the cost they pay out of pocket. So can you tell us a little bit more about that?
Absolutely. There's different programs based on your income and resources, and they're called Medicare Savings programs. So Medicare Savings programs are federal programs that are available to folks with lower income and lower resources. So depending on where you stand on those income line are going to depend on what level of help you receive as far as premium help, deductible help. So it's really going to depend on your specific income and resources. We have a saying at OSHIP, when in doubt, fill it out. So if you think you might qualify for one of those programs, call us at OSHIP. We can walk you through that and we can help you with that application process as well.
It's great to know. You've shared with us some brochures, Medicare Savings that tells more information. We've got these at the Department of Aging.
Absolutely.
We'll, if someone calls us, we're happy to mail it out, share information. So I want to tell you, sometimes older adults tell us, and my mother included, who's 87, that she gets a lot of mail around Medicare, and sometimes she finds it really overwhelming to determine what's really from Medicare and what's from the different plans. So what advice do you have for viewers out there about the amount of advertising they get?
I can relate to that so much. My dad just started Medicare at 65 last May, and he's been showing me all of the mail that he is receiving. And like I said, I've been doing this for 5 years, and I'm still surprised how inundated our seniors are. He would hate that I called him a senior, but he is, with mail and with the advertising. So I would say a couple of things. Anything that comes from Medicare is going to have a Medicare seal on it, for a CMS seal. The other thing, that anything's an advertisement has to say on it that this is not a piece of mail from the federal government. So they have to make it very clear. Unfortunately, sometimes it's very clear in that it's teeny tiny little print at the bottom. One of the things that we can do at OSHIP, if you call us, we can help you determine if something you received is an official piece of mail from a government agency or if it's an advertisement. If you know it's an advertisement, you can call us at OSHIP and say, I got this advertisement, here's what it says. Can you talk me through what this program, what this insurance plan looks like? So if you're hesitant to reach out to that person who is sending that advertisement and you want some unbiased, objective information, that's something that we can offer you at OSHIP. A lot of advertisements are advertising something that may help you. I mean, that's true. But we can help you at OSHIP wade through which ones are and which ones aren't, and let you know if those programs are, if you qualify for them, or what they look like in reality. So that's something that we are extremely happy to do at OSHIP, is help you wade through those advertisements.
I think we need to use that phrase, when in doubt, call OSHIP.
Exactly.
Right?
Yes.
If you're not sure what something means or how this might affect you. So let's talk a little bit then about fraud. I know that's a real commitment of the state agency around Medicare fraud. So what should viewers know about Medicare fraud?
Absolutely. So one of the great things about the OSHIP program being hosted inside of ODI is we know that the ODI takes fraud extremely seriously. So anything that they see with any insurance fraud, and including Medicare fraud, is something that we really take seriously. So we encourage you, if you see anything that you might think is Medicare fraud, improper agent activity, to call us on our hotline. So just to run through a couple of those things and what that might look like. Any door-to-door sales. No one should ever be coming to your door to sell you a Medicare product unless you've specifically invited them.
Okay.
So we see that a lot in apartment buildings. You know, someone might go to an apartment building, and that's easy to go door to door and hit a lot of doors there. But anywhere, door-to-door sales, prohibited. Any high-pressure sales tactics. And that's one of those things that you kind of know it when you see it. You know, it's hard to describe, but you know it when you see it. Misrepresenting a plan. If someone comes and they tell you Medicare Advantage plans, for example, they have networks of doctors and providers. And if you have an agent telling you that a doctor is in network and you find out that they aren't, that's really misrepresenting a plan. The biggest thing that we're seeing right now, and it's really hard to investigate this, is because it's over the phone, is people calling and identifying themselves as calling from Medicare. If I could tell seniors one thing about fraud, Medicare fraud, no one from Medicare is ever going to call you. Someone calls, you pick up the phone, and they identify themselves as calling from Medicare, that's a red flag right away that that is a fraudulent phone call. They may call and want you to confirm your Medicare number or confirm your birthday, or we were seeing for a really long time, give us your address and we'll send you free COVID tests, things like that. Important to know, Medicare does not make outgoing phone calls. So that's the biggest thing we're seeing right now.
And Sarah, your advice then to someone who receives a call like that, would that be just go ahead and hang up?
Go ahead and hang up. We would say, you know, you can call us and give us their phone number. Unfortunately, phone numbers are just so easy to cycle through. But let's say someone calls and they have a lot of information about you. They have, you know, EOBs, explanation of benefit information, you know, the last hospital you went to, and you're really thinking, this really sounds like Medicare. Hang up, give us a call. If Medicare is trying to reach you, we will know that, and we'll be able to help you navigate how to get in touch with them.
Really important information for viewers to know.
Absolutely.
So there's a lot of choices out there. You've talked about them, the number of plans. What's the easiest way for someone who's choosing a plan to get that price and plan comparison?
To call us at OSHIP. We can do that in an objective and unbiased way. The other thing that I wanted to touch on is we have a whole host of volunteers throughout the community. If you don't want to talk to someone over the phone, some of these appointments can take up to an hour to really talk to people thoroughly and make sure they understand all of the options available to them, including those individual plans. It might be easier to do that face-to-face. So if that's something that you're interested in, we have a network of volunteers throughout the Cleveland area that we can get you in touch with to sit down and talk to each other face-to-face. We have people who are working as volunteers as a professional capacity inside state agencies like yours or city agencies. We also have what we call true volunteers who are just members of the community who we have really poured into, and they've dedicated themselves to knowing everything there is to know about Medicare so that they can meet people one-on-one face-to-face. So if you're looking for that face-to-face interaction with somebody, you can also call us at OSHIP and we can hook you up with one of our volunteers that are out in the community.
That's great to know. So we've got 4 staff in the Department of Aging who've gone through the OSHIP certification training, which is pretty intense.
Yes, it is pretty
and
intense.
they feel empowered with information to be able to share out in the community. And so you can come to our office, but what I'm hearing you say is you can go to a library and meet someone. You can at a local senior center. You can find an OSHIP volunteer by calling the OSHIP office.
If you're watching this outside of the city of Cleveland and you want someone in your suburb, there is someone there for you. And we have people off the top of my head, Avon Lake, Bay Village, all over the east side, Shaker Heights, Cleveland Heights. We've really tried to make sure that there's someone available close to all of our Ohio beneficiaries so they can have that face-to-face, one-on-one interaction if that's something that their need or they're interested in.
It's a great resource. We do need to dedicate a little bit of time to Part D.
Oh, absolutely.
D for drugs, prescription drugs. Many of us are on them. We likely are going to be on more of them as we age. So just tell us, what is Part D?
So Part D is your prescription drug coverage. Regardless of if you have original Medicare or if you have a Medicare Advantage plan, you have a Part D component to your plan. There is a lot of options when it comes to Part D. You can pick from 23 different plans here in Ohio. All of those plans have a different formulary. So how they cover those drugs is going to vary from plan to plan. So there is no best prescription drug plan. There's only a best plan for you. And it's really important to understand that these plans change every single year. So I always say, think about your Part D plan as a 1-year contract. It goes from January 1st to December 31st. And every fall during open enrollment from October 15th to December 7th, you have the ability to change your plan for the following year. So it's really important to understand that those plans change. So if you called us last year and we helped you pick out a plan, and now you're going to roll into 2023, you might be thinking, well, I already called them, they helped me, I don't have any changes, I haven't gotten any new drugs, I haven't changed my pharmacy, I'm happy with my plan as it is. It's important to understand that that plan can change. So they can make changes to their plan. They can change your premium, they can change your drug prices, they can change their preferred pharmacy. Or it might be quite as simple as a new plan has come along that's even better for you. So it's really important that you look at your plan every single year. And again, that's from October 15th to December 7th. You can call our hotline. You can call the Cleveland Department on Aging. You can do it yourself on Medicare.gov if you're especially computer savvy. Looking at your Part D plan is the easiest way to save money when it comes to Medicare. We know from helping people every year that people are paying too much for their prescription drugs. Not only are prescription drugs expensive in general, but people are paying too much than they could be because they're not on the right prescription drug plan.
Really good information to share. We've got this extra help for Medicare Part D. This is one of the savings programs out there. We'll help people at the Department of Aging sign up. People can call OSHIP to find out additional ways to save money on Part D. So I want to do a little plug for your network of volunteers because you're always looking for more.
We are always looking for more volunteers. Volunteering for OSHIP is really fulfilling. I know that all of our volunteers really feel like they're really helping people in the community. So if you have any desire to learn about Medicare and so you're able to help people in your own community when it comes to their Medicare decisions, I really encourage you to reach out to OSHIP and we can get you trained and we can get you out in the community. Like I said, it's extremely fulfilling. Medicare is an extremely complicated topic. People are nervous, people are scared sometimes, which is completely understandable. So volunteering is a really great way to really help out seniors in your community.
I bet it makes a big impact.
Yes, absolutely.
One-on-one.
Yeah.
Sarah, what else do we want to make sure viewers know? Is there anything more?
I really just want to make sure viewers understand that we're here for them in that objective, unbiased way. Making sure you're looking at your Medicare plan every single year to make sure you have the best option available to you. And I do want to plug our phone number, of course,
Please.
at 1-800-686-1578. We take calls Monday through Friday from 7:30 to 5. And again, I really want to stress that's a local hotline. You're going to get someone sitting in downtown Columbus who's going to be able to help you with your Medicare in that unbiased, objective way.
And then I want to recap that they can find you out in the community.
Yep.
You're doing presentations regularly.
Absolutely.
You're also on your website, there's some webinars.
Absolutely. So we go out in the community year round. We go, like I said, senior centers, libraries, basically anyone that'll have me to talk about Medicare. I want to go where the people are. So if you want to see a face-to-face presentation, you can call our hotline and they can hook you up for where we're going to be next in your community. Like you said, you can visit our website. We have webinars recorded on there, Medicare 101s, 45 minutes where we talk about everything you could ever want to know about Medicare. So just knowing that all the resources are available to you. And we really want to help. We really want to get the information out there into the community.
So Sarah, let's say that phone number one more time.
1-800-686-1578.
Sarah, thanks so much for joining us today.
Absolutely.
This information is valuable. All of us, as we turn 65, if we're fortunate to be able to do that, are going to be tapping into the Medicare system.
Absolutely.
And we need to know as much information to make the right choices available to us. I want to thank you for training our staff at the Department of Aging, and want to reassure viewers that if you call the Cleveland Department of Aging, we can assist you, connecting you to OSHIP or answering your questions. So thank you for joining this segment of Age Friendly Cleveland. I look forward to seeing you soon.